Good evening, dear friends, dear colleagues from all over the world. I guess my name is Miroslav Solonko, and today it's my privilege and honor to moderate a great event, a webinar that we have organized with a dental study from Ukraine, and we are really happy to have with us Arthur Novaes. He will be presenting on the topic of prevention and treatment of periimplantitis. Let me just read the short introduction of Dr. Novaes. He received his DDS degree from the University of Campinas in São Paulo, Brazil, and he has his certificate of advanced graduate studies in periodontology and Master of Science in Dentistry at Boston University School of Dental Medicine in USA. And he also holds the Doctor of Science in Microbiology at the Federal University of Rio de Janeiro, Brazil. And Dr. Novaes is also the Associate Dean of School of Dentistry of Ribeirão Preto of the University of São Paulo, Brazil. And he was from 2016 to 2020. And he is chairman of Periodontology School of Dentistry of Ribeirão Preto of the University of São Paulo. And he has almost approximately 300 papers published in international journals and 4 books. It's really amazing. And he is also the editorial advisory board of the Journal of Periodontology and president of the Brazilian Academy of Osteal Integration. He was a president from 2004 to 2008. So it was a brief introduction. I will not take more of your precious time. I want to give the word to Dr. Novaes. And Dr. Novaes, nice to see you here. And the stage or the Zoom platform is yours.
Thank you, Miroslav. I would like to thank iDental Study for the invitation. It's really a pleasure to be part of such a beautiful charity project, and actually I'm very honored to be part of such a project. And I think it was a marvelous idea, and I hope all the people all our colleagues can join in, okay? So, we'll be talking this evening on the prevention and treatment of periimplantitis. But before we get to actually talking about prevention and treatment, which we have to know a lot, as much as we can, about the disease, periimplantitis. That's the knowledge of what it means, what the disease consists of, is that will lead you and allow you to pursue the prevention and the treatment. Systemic reviews on the incidence, prevalence of periimplantitis vary according to the study, but it varies from 25 to 45% of implants placed will develop periimplantitis. We are placing yearly about 3 million implants worldwide. So we do the math, 40% of 3 million, it's a very significant number. So it's a very significant problem, very significant disease, and it will increase because more people, more dental students will graduate, more people will be involved with dental implants, So, well, of course, it's let's say it's like another pandemic that we have to deal with it. And we are on the losing side so far. It's also important to know the etiology and the risk factors for developing periimplantitis. That's actually where the prevention will come in, and then later on, the treatment. So the main cause of periimplantitis, obviously, is the biofilm. And that, just like periodontal disease, it will create like a pocket and bone loss. And it's a major factor in that is patients that previously have a history of periodontitis. That's the main cause. Teeth are lost and replaced by peri-implants. This study that I have on the left here states that patients with a history of chronic periodontitis have 14 more times of developing periimplantitis. So it's a very significant factor. And if you add to that smoking and diabetes, then it goes off the roof. So we have to understand something about periodontitis, which is obvious to some, but it's worth mentioning.